Welcome to Medical Field Notes, the segment where we invite our providers and healthcare professionals to share their notes from the field on the topics and questions our community wants to explore. I'm here again with Tarrah Harman, our cardiopulmonary manager, and I'm Kirsten Newland, Director of Communications and Development. Welcome back, Tarrah.
Thank you.
Yeah, today we're going to talk about COPD. So let's jump into it. Tell us, what is COPD, first of all?
Okay.
What does it stand for?
COPD stands for chronic obstructive pulmonary disease.
Okay, that's a mouthful.
Yes, yes.
I'm glad there's a shorter version of it. So how does one develop this disease?
Usually it's going to come from a smoking history.
Okay.
So with that, your lungs just aren't quite as, they're not working the way that they used to. They're not as elastic as they used to be. You can have some air trapping, so your lungs just aren't bringing the air in and out like you're supposed to.
Okay. Okay. And why? So chronic obstructive. So I'm assuming that there's some sort of blockage.
Mm-hmm.
Okay.
So with obstructive, like you're able to get all the air in your lungs, but you can't push it out.
Okay.
So a lot of these patients have a hard time, like exhaling all their air. So it kind of it traps into their lungs.
And so you mentioned COPD last week when we talked about it. So diagnosed with a PFT, correct? A pulmonary function test?
Yes.
Okay. And then once a patient is diagnosed with COPD, what would be the next steps for their care journey?
They should probably see a pulmonologist to monitor their disease.
Any particular pulmonologist?
Martinez, we have
Dr.
here.
Martinez.
Yeah. So I would follow up with a pulmonologist. A lot of times they'll do routine pulmonary function testing just to kind of track, the disease and make sure that it's not worsening over time. They should quit smoking. That's the main thing.
What kind of support do we provide for? Because that can be a really difficult journey to, quit smoking. What kind of support do we provide for smoking cessation?
So we have pulmonary rehab. A lot of these patients we can see in the pulmonary rehab, and we do a lot of education with them. We do a lot of training just to teach them their better ways to do simple things, to have a better quality of life.
Okay.
So while they're in pulmonary rehab,
lifestyle changes in a way, and I'm sure just that accountability of a team that gets it is really meaningful. That also is very connected to the clinical side of things as well. So what does it take once, if a patient has COPD, what does it take from their side? Besides quitting smoking, what else might change about their life over time? How else do they need to care for their lungs?
So patients that have COPD, they will be put on inhalers. A lot of time they're going to be a maintenance inhaler. There'll be a long-acting bronchodilator that's going to kind of help keep their lungs over a period of time. And then also an inhaled steroid. So that's going to kind of help keep the inflammation down in their lungs. But they need to stop smoking and then just monitor as they go. With the quality of life, they may have to alter how they do their everyday things. So simple things like just making their bed, combing their hair, little things like that can even make them short of breath.
Well, thank you, Tarrah. This has been very educational, and I'm glad that we learned about this, and thank you for the support and the care that your team provides.
Thank you.
Thank you for watching Medical Field Notes. To learn more about healthcare in Hillsdale County from Hillsdale Hospital, you can visit our website at hillsdalehospital.com or our social media pages for more conversations about healthcare that are just like this. Or check out our national podcast, Rural Health Today, at ruralhealthtoday.com or wherever you get your podcasts. We'll be back next week with another installation of Medical Field Notes, but until then, stay safe, stay healthy, and remember, rural health strong.